Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College, also Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. And in addition, I'm Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, September 12th, 2022. At the very moment a better coronavirus vaccine has finally become available, America's vaccination response has begun to retreat. In addition, local health department workers responsible for COVID and flu shots this fall have also, without new staffing, been juggling a monkeypox outbreak and childhood immunization deficits that have left some places susceptible to polio. And some state health officials, citing weak demand for vaccines and increased survival rates of late, have stopped aggressively pushing coronavirus shots. Local programs to bring shots to the places where Americans gather and the institutions they trust have closed, a consequence in some cases of congressional resistance to more pandemic response spending. As attention to the COVID pandemic wanes, temporary emergency changes that were made to the Medicare and Medicaid programs also are coming to an end. Today, I'm going to provide an update on where emergency federal COVID-19 policies and programs that were adopted and provide some clarity on where they are heading. I'll follow that with an update on new reported cases, hospitalizations, and deaths, both nationally and in Tennessee. With more than 2 years having passed since the COVID-19 pandemic began in early 2020, questions are being raised about when to end the public health emergency declarations made by the federal government early on, with some advocating for their extension and others calling for their expiration. There are numerous implications to ending these emergency declarations, each of which gave the federal government flexibilities to waive or modify certain requirements in a range of areas, including in the Medicare, Medicaid, and CHIP programs, and in private health insurance, as well as to allow for the authorization of medical countermeasures and to provide liability immunity to providers who administer services, among other things. Congress enacted legislation that provided additional flexibilities tied to one or more emergency declarations, and as two are scheduled to expire when or at a specific or a specified time after the emergency period expires. Today, I'm going to provide an overview of the major health-related COVID-19 federal emergency declarations that have been made through the Medicare and Medicaid programs, summarize the flexibilities triggered by each, and identify the implications for their ending. I'll start with the Medicare program. Through current emergency federal declarations, beneficiaries in traditional Medicare and Medicare Advantage pay no cost sharing for COVID-19 at-home testing, up to 8 tests per month, testing-related services, and certain treatments. Millions of people have received free COVID-19 testing and testing-related services, certain treatments, and vaccines during the Section 319 public health emergency. Not all of these items will continue to be free when the public health emergency expires. When Section 319 PHE ends, Medicare beneficiaries will face cost-sharing requirements for at-home testing, testing-related services, and all COVID-19 treatments. However, coverage of COVID-19 vaccines will continue at no cost due to statutory changes made by the CARES Act that added coverage of COVID-19 vaccines to Medicare Part B. Clinical diagnostic testing is also covered at no cost. Among the other major changes to Medicare during the public health epidemic or emergency was the expanded coverage of telehealth services. Telehealth accounted for 12% of all services used by beneficiaries during the first year of the pandemic. Changes made by the Consolidated Appropriations Act of 2021 enabled beneficiaries to remain in their homes for an expanded list of Medicare-covered services to be covered by telehealth visits reimbursed by Medicare, rather than needing to travel to a healthcare facility. It also allowed telehealth visits to be delivered via smartphone in lieu of equipment with both audio and video capability. Medicare beneficiaries in any geographic area through this emergency measure could receive telehealth services rather than beneficiaries living in rural areas only, as was previously the case. Based on changes in the Consolidated Appropriations Act of 2021, Medicare has permanently removed geographic restrictions for mental health and substance abuse services and permanently allows beneficiaries to receive those services at home. Medicare now permanently covers audio-only visits for mental health and substance use services. But absent to permanent changes to Medicare coverage, most Medicare beneficiaries will lose access to coverage of nearly all telehealth services on the 152nd day after expiration of Section 319 of the Public Health Emergency, unless they reside in rural areas or enroll in Medicare Advantage. In addition, all states and D.C. temporarily waive some aspects of state licensure requirements so that providers with equivalent licenses in other states could practice via telehealth. In some states, these waivers are tied to the end of Section 319, the Public Health Emergency. In others, they have expired. Some states have made allowances for long-term or permanent interstate telemedicine. Additionally, DEA-registered providers can use telemedicine to issue prescriptions for controlled substances to patients without an insurance evaluation if they meet certain conditions. Next, I'm going to switch to the Medicaid program and talk about some of the emergency waivers that have been granted. Under Medicaid, COVID-19 Section 1115 demonstration waivers allowed the Department of Health and Human Services to approve state requests to operate Medicaid programs without regard to specific statutory or regulatory provisions to furnish medical assistance in a manner intended to protect, to the greatest extent possible, the health, safety, and welfare of individuals and providers who may be affected by COVID-19. Expanded Medicaid services include long-term care services, eligibility and benefits, increased provider payment rates, increased beneficiary access to medications, and increased access to telehealth. Under the Section 1115 waiver, states received enhanced federal matching funds if certain conditions are met, and enrollees of Medicaid and CHIP receive coverage of COVID-19 vaccines and vaccine administration without cost sharing. These benefits will expire on the last day of the first calendar quarter beginning 1 year after the end of Section 319 Public Health Emergency. For Medicaid and CHIP enrollees, state Medicaid programs will be allowed to continue to cover COVID-19 testing, treatment, and vaccines for most adults after federal coverage requirements related to the Section 319 PHE Public Health Emergency expires. For people without insurance, there will no longer be a pathway through Medicaid for free COVID-19 testing, vaccines, or treatment. In 20 states, it is estimated that about 13% of Medicaid enrollees will be disenrolled when the continuous enrollment requirement ends. Privately insured individuals could incur additional out-of-pocket costs for tests and related services when the Section 319 public health emergency ends. People with private insurance will continue to have coverage of COVID-19 vaccines at no cost from in-network providers due to statutory changes made by the CARES Act that extended the requirement under private insurance for coverage of preventive services at no cost to include COVID-19 vaccines. So as a federal emergency response to the COVID-19 pandemic winds down, we need to be aware that many of the programs and benefits that were adopted to help state and local governments respond also will wind down. Next, I'm going to provide the national and Tennessee statistics. So known coronavirus cases have fallen significantly in recent weeks, with the national average falling below 90,000 cases per day just before Labor Day. The holiday has skewed current figures somewhat since many states reported delayed or incomplete data in the aftermath of the long weekend. Still, case counts are in far better shape than a month ago, when nearly 120,000 cases were identified each day. Cases have decreased over the past 2 weeks in all but a handful of states. In the Northwest, Washington, Oregon have both seen cases fall by more than 20%. Hospitalizations also have seen sustained improvement. Fewer than 35,000 people are currently in American hospitals with the coronavirus each day, a decrease of 13% over the past 2 weeks. Data on new virus deaths is particularly volatile this week due to holiday reporting disruptions. Still, deaths today are far lower than they were a week ago or a year ago, when the Delta variant was causing more than 1,500 per day. In Tennessee, we have finally seen a downturn in cases, hospitalizations, and deaths. While Tennessee still ranks 11th highest among states in reported cases of COVID-19 over the past 2 weeks, new cases in Tennessee are down 61% to 1,665 per day, or a rate of 24 per 100,000 of the population. Hospitalizations and deaths also both are down for the past 2 weeks. Hospitalizations are down 8% to 839 per day, while deaths are down to 6.1 per day, or 0.09 per 100,000, slightly below the national average of 0.11 per 100,000. Test positivity in Tennessee also is down to 21% from 27% 2 weeks ago, but still remains the 4th highest of any state in the country. The percent of persons who are fully vaccinated remains at 55% for the 13th straight week. 16 counties in Tennessee are now in the CDC's red zone, down from 36 2 weeks ago, and 29 are in the green zone, up from 2 weeks ago. The remaining 50 counties are in the yellow zone, down from 57 2 weeks ago. Nashville-Davidson County is now in the yellow zone after 11 consecutive weeks in the red zone. Of the 4 major metropolitan areas in the state, only Chattanooga-Hamilton County is still in the red zone. So for now, this is Dr. Paul Juarez from Tennessee SEAL and HealthWorks at Meharry, wishing you a good day. Be safe.